Good afternoon, ladies and gentlemen. My name is Adiba Lawa. The topic before me this evening is postpartum depression. Um, First, while trying to make a PowerPoint about postpartum depression, I try my best to really search for the sociological aspect or psychological aspect of postpartum depression. I didn't really want to make it um all medical affair. Um, I hope I've been able to do this. So I'll start by um explaining what postpartum depression means. Postpartum depression is a mood disorder that can affect women after birth. Mothers with postpartum depression experience feelings of extreme sadness, anxiety, and exhaustion that make it difficult for them to complete daily care activities for themselves or for others. Those who develop postpartum depression are at greater risk of developing major depression. So this is why it is very important to pay close attention to women, especially after delivering a baby. Like it's okay to have baby blues, but it's not okay to have postpartum depression. And if they do, then there is a treatment for this. And that leads me to the next slide. Postpartum period is typically the first 6 weeks after delivery, and 50% to 80% of women experience transient baby blues within the first 2 weeks following delivery. So the question is, what is baby blue? Baby blues are a feeling of sadness a woman may have in the first few days after having a baby. Baby blues are also called postpartum blues. Baby blues usually go away by themselves without medical treatment. And so, baby blues, it's common, like from the statistics, 50% to 80% of women experience transient baby blues. So it's okay for women to be temporarily really depressed for few days or 1 or 2 weeks after birth, but it becomes a concern when they are still depressed after 1 2 weeks. Then um help should be sought. Impact of postpartum depression. Um, the impact of postpartum depression, this could impact the mother, it could impact the baby, and it can also impact the relationship between the mom and the father of the baby. So the impact could have on the baby are delayed cognitive and psychological development, facial and focalized less, delay motor skills, increase healthcare resource use. This is this is related to when like baby should have developmental milestone. So if at a particular age, let's say 3 months or 4 months, the baby should be doing something, maybe smiling, and the baby is not smiling, then there is cause for the parent to take the baby to the hospital, and the healthcare, they have to carry out some tests to determine what is wrong with the baby. This increase the healthcare resource use. It's also increase the cost of taking care of the baby, compared to a normal baby that is following the normal developmental milestone. And also the impact on the relationship is risk for dissolution, because you have a situation whereby this can bring about strain in the relationship, between the mother and the father. The father is not feeling the mother, that is always depressed, and he doesn't know how to manage this. This can actually lead to it can lead to dissolution. So what are the signs and symptoms of postpartum depression? What signs do we look at fall in a mother after delivering a baby. Just as I've said in the previous slide, I said it's okay if it's okay for baby blues because 50 to 80% of mothers go through this. But after 2 weeks, what signs do you look out for to know that the mother is going through postpartum depression? So one is hopelessness, then helplessness, you have irritability, low self-esteem, anger, resentment towards the baby, or thought of harm to the baby, inability to adjust to role of motherhood, sleep, appetite disturbances, mood changes. So these signs and symptoms are very serious, and it should not be taken lightly, and it should be reported because especially it, as it concerns the safety of the baby, the mother, and whoever is staying with them, because these are really signs of depression we should be taken seriously. What are the risk factors for postpartum depression? Patient history is very important, like when during the prenatal stage, like you have to conduct get past medical history, the patient history, like. So the risk factors for postpartum depression are patient history of mood disorder prior to pregnancy, family history of mood disorder. So that means if there is anybody in the patient's family that's ever experienced postpartum depression, it places the mother at risk of experiencing the same. It may not happen, but it should be taken into consideration. Another one is symptoms of depression during or after a previous pregnancy, a stressful life event during pregnancy or shortly after giving birth, such as job loss, death of a loved one, domestic violence, or personal illness. Medical complications during childbirth could also be responsible for this, including premature delivery or having a baby with medical problems. And also, alcohol and other drug abuse is also a risk factor. So, what are the screening we do, for women, when they are pregnant to give us an idea if the likelihood of them experiencing postpartum depression. So we ask three simple questions. One is we ask the the pregnant woman if she has ever felt overwhelmed. If she has felt if have you felt we ask her, have you felt overwhelmed in the last 7 days? Do you have thought of harming yourself or your child? Are you having difficulty adjusting to your new role as a mother? If they answer yes to any of the above questions, then provide referrals to public health nurses or their healthcare provider. We can screen them. Treatment. If found at risk for postpartum depression, the patient should be referred to their primary healthcare provider or refer the patient back to their OBGYN. A patient is to be found to have a higher risk, that is suicidal, referred to a crisis line or emergency psychiatric evaluation. This is very, very important because any patient experiencing, whether pregnant or not pregnant, that's experiencing depression is always placed on suicide watch. This is very, 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 very important to know. So, in summary, postpartum depression is relatively common. It may have long-term consequences for mother, infant, and family. It's easily missed. It's easily missed, should be screened for, and can be treated successfully. So these are my references. With this viewpoint, I hope I've been able to explain briefly what is meant by postpartum depression, the risk factors, and the screening. And also it is very important, like it's not abnormal for women to experience postpartum blues for 1 or 2 weeks. It usually go by itself without any medical treatment. But if it linger on to maybe 3 weeks, 4 weeks, then help should be sought as soon as possible. Thank you very much.